I never consulted a politician, and no doctor ever should. At a time when our country is facing a critical physician shortage, Republicans are threatening them with going to prison simply for providing evidence-based care. This legislation fundamentally breaks a critical trust between patients, their parents, and their physicians, pulling them into a dangerous political crusade that targets our vulnerable transgender youth. I offered 2 amendments. 1, ensure no doctor can be imprisoned for providing evidence-based care, and 2, providing parents with protection when supporting their children's health. Republicans refused a vote on both. We should be empowering doctors to take care of their patients, not locking them.
Did you hear that? And do you feel what I feel? Because this is the America we live in right now. And I need you to understand the sheer magnitude of what just happened when the United States House passed a bill that would make doctors and parents criminals for providing gender-affirming medical care to transgender minors, and we are talking about up to 10 years in federal prison for physicians doing their jobs and following the evidence. And I want you to sit with that for just one moment, because we need to absorb the grotesque horror of what Marjorie Taylor Greene and her Republican co-conspirators have just accomplished in this chamber that is supposed to represent the will of the people. This happened literally hours ago as the last vote of the day on Wednesday evening, and let me tell you what they're celebrating and what the implications are for every single vulnerable young person in this country who already faces a mental health crisis of staggering proportions because of exactly this kind of state-sanctioned persecution disguised as protection. We're watching this physician speaking truth to power, and you can hear the moral clarity ringing through every word when she says Republicans are threatening doctors with prison for providing evidence-based care. And she's not being hyperbolic here, because the American Civil Liberties Union says it is the most extreme anti-trans legislation ever considered by Congress, and I need every single person listening to understand that this isn't some theoretical debate about abstract principles of governance. This is about the lived reality of children who are already among the most vulnerable populations in our society. The Trevor Project's research shows that access to gender-affirming care has been linked to lower rates of depression and suicidality for young trans and non-binary people, and what Republicans are doing here is not protecting children, but rather condemning them to suffering and isolation and despair. Let's talk about what evidence-based care actually means, because this is where the Republican lies become so transparent and so cruel that it takes your breath away. Gender-affirming medical care for kids is considered safe and appropriate by major medical organizations, including the American Medical Association, and we're talking about organizations that collectively represent more than 1.3 million doctors across America. The American Medical Association passed a resolution to protect access to evidence-based care, noting that widespread misinformation and bans do not reflect the research landscape, with more than 2,000 scientific studies examining aspects of gender-affirming care since 1975, and yet Republicans have the audacity to stand in chambers of power and claim they're protecting children, when what they're actually doing is inserting their theological prejudices and their electoral calculations between patients and their doctors. This physician congresswoman is telling us exactly what happened, and pay attention because this is where the procedural violence becomes clear as day. She offered 2 amendments and just listen to what they were. 1, to ensure no doctor can be imprisoned for providing evidence-based care, and 2, to provide parents with protection when supporting their children's health, and Republicans refused to vote on both amendments. They refused to even vote on both amendments. They refused to even vote on whether doctors should be protected for following medical science, and whether parents should be protected for loving and supporting their children. And if that doesn't tell you everything you need to know about the authoritarian impulse driving this movement, then I don't know what will. They talk endlessly about parental rights when they want to ban books about Rosa Parks, or prevent teachers from acknowledging that gay people exist. But the moment we're talking about parents who are supporting their transgender children in accessing medical care that could save their lives, suddenly parental rights disappear into thin air, because this was never about parental rights or protecting children. This has always been about enforcing a rigid gender binary rooted in Christian nationalist ideology and punishing anyone who dares to exist outside of it. And here's what makes this even more devastating. Nearly the entire South has banned gender-affirming care for youth, with trans kids living in Atlanta facing almost 7 hours drive to reach a gender clinic as of July 2024, and now Republicans want to make it a federal crime punishable by a decade in prison to help these families. Greene's bill would subject anyone who facilitates or transports a minor for gender-affirming care to the same 10-year sentence, which means that if you're a parent in Mississippi or Alabama or Georgia trying to drive your child to a state where they can access life-saving medical care, you could be prosecuted as a federal criminal Think about what that means for a moment. Think about the families who are already making impossible choices and facing financial devastation just to keep their children alive, and Republicans want to criminalize that love and that desperation. We need to understand the broader context here, because this bill that just passed the House is part of a coordinated nationwide assault on transgender existence that has been methodically planned and executed by right-wing legal organizations and dark money groups. Since 2021, a wave of legislation targeting transgender healthcare has swept across the United States, with 25 states enacting blanket bans on gender-affirming care for transgender youth. As of March 2025, 6 states have made it a felony crime to provide certain forms of best practice medical care for transgender youth. This is not happening in a vacuum, and this is not a grassroots movement of concerned parents. This is being orchestrated by organizations like the Alliance Defending Freedom, which has been designated as a hate group, and which has explicitly stated its goal is to push transgender people out of public life entirely. And the Supreme Court just made everything so much worse, because in June of 2025 they handed down their decision in U.S. v. Crusade, upholding Tennessee's ban on youth gender-affirming care, and ruling that these bans do not violate the U.S. Constitution's Equal Protection Clause, and this decision has given Republicans the green light to accelerate their elimination agenda at both the state and federal levels. The court basically said that states can discriminate against transgender youth in ways that would be considered outrageous constitutional violations if applied to any other group, and this is what happens when you have a Supreme Court that has been captured by the Federalist Society and packed with ideologues who care more about enforcing their vision of traditional values than protecting the fundamental rights and dignity of marginalized people. But let's get back to this physician's powerful testimony, because she's naming something that we need to be shouting from the rooftops. At a time when our country is facing a critical physician shortage, Republicans are threatening them with going to prison. Think about the policy insanity of that. For just 1 second, we have rural hospitals closing across America. We have physician burnout at crisis levels. We have medical deserts where people drive hours for basic care. And Republicans think the solution is to criminalize doctors for providing treatments that are endorsed by every major medical organization in the country. Studies have consistently demonstrated that providing gender-affirming care that is both age-appropriate and evidence-based leads to improved mental health outcomes, while conversely denying such care is linked to a greater incidence of anxiety, depression, and self-harm. And so what Republicans are doing here is not just attacking transgender youth, they're attacking the very foundation of medical practice itself. This is about who gets to make medical decisions, and whether we live in a country where science and evidence matter, or whether we live in a theocracy where politicians' religious beliefs can override the expertise of trained medical professionals. Representative Sarah McBride said that Republicans were trying to politicize a misunderstood community and misunderstood care, noting that no one's health care should be politicized, and she's absolutely right. But we need to go further and say that what Republicans are doing is not just politicization, but medicalization of bigotry. They're taking their disgust and their fear and their discomfort with gender diversity, and they're dressing it up in the language of medical concern and child protection, when the actual medical community is begging them to stop. Let me tell you what this bill actually does, because the cruelty is in the details. The Protect Children's Innocence Act would impose felony penalties of up to 10 years in prison on physicians who provide puberty blockers, hormone therapy, or surgical care to patients under 18, and would also expose parents and others who consent to or help minors access that care to criminal liability. Now, Republicans love to claim that they're talking about irreversible surgeries being performed on young children, but that's a lie, because surgeries for transgender children are rare. The bill aims to halt gender-affirming surgeries on minors, which is rare. What they're actually targeting are puberty blockers, which are temporary and reversible, and are also used for non-trans youth who experience early-onset puberty. But somehow when cisgender children need these medications, they're fine. But when transgender youth need them, suddenly, it becomes child abuse. The hypocrisy is absolutely staggering, because the bill explicitly permits non-consensual surgical procedures on intersex infants and youth, which means that Republicans are perfectly fine with doctors performing actual irreversible genital surgeries on babies who cannot consent, as long as the goal is to make those babies conform to a binary understanding of sex. But if a teenager who has spent years in therapy with their parents and their doctors, making careful, informed decisions about their own body, wants access to reversible hormone therapy that becomes a federal crime, this isn't about protecting children's bodies from medical intervention. This is about enforcing conformity and punishing deviation, and if you can't see that, then you're not paying attention. Now, this bill is unlikely to pass the Senate, at least in this session, because it now goes to the Senate, where it is unlikely to pass, but let me tell you why that doesn't mean we can breathe easy for even 1 second. First of all, Trump's administration is already implementing these policies through executive action, because the Trump administration is eyeing a proposal to cut off hospitals' Medicare and Medicaid payments if they perform gender-affirming medical procedures for transgender youth. With the proposal currently under White House review, hospitals are highly reliant on Medicare and Medicaid, with losing access to that coverage potentially crippling facilities. So even if this specific bill doesn't become law right now, the administration is finding ways to achieve the same result through regulatory action and financial coercion. And second, the very fact that this bill passed the House normalizes the idea that criminalizing healthcare is acceptable. LGBTQ advocates warn that merely bringing such a bill to a vote normalizes the idea of criminalizing healthcare and intensifies fear among families already navigating hostile state policies, and that fear is already having devastating real-world consequences. Major medical institutions, including Children's National in Washington, D.C., and Children's Hospital in Los Angeles, have announced the shutdown of pediatric gender-affirming care services, citing the legal and regulatory risks and Housemenals of Talman Hudverdian, the Says per Tolman Hudverdian. In the states where the care is still legal, many clinics and hospitals have ended their programs for gender-affirming care. This is what the chilling effect looks like. This is doctors being terrorized out of providing care, even when it's still technically legal, because they're afraid of prosecution, or losing their medical licenses, or having their hospitals financially destroyed. Let's talk about what this means for the actual human beings at the center of this manufactured crisis. Because a mother of a trans 15-year-old said on a Human Rights Campaign press call that Congress has to reject these bills because they are so dangerous and insulting to families like hers, noting that her family recently left the United States due to anti-trans policies. American families are fleeing the country. They're becoming refugees because the government is making it impossible for them to keep their children safe and healthy. And you want to tell me this is about protecting children? Families with transgender youth across the country have already taken the dire step of leaving the United States for fear of exactly this kind of proposal becoming the law of the land, and that should be a source of national shame. The research is absolutely clear, and Republicans simply do not care. A 2022 peer-reviewed study published in the Journal of Adolescent Health by researchers at the Trevor Project found that gender-affirming hormone therapy was significantly related to lower rates of depression, suicidal thoughts, and suicide attempts among transgender and non-binary young people, and a 2022 study published in the Journal of Adolescent Health found trans youth were significantly less likely to be depressed or suicidal when prescribed puberty blockers. We're not talking about experimental treatments here. We're not talking about some fringe medical practice. We're talking about care that medical organizations including the American Medical Association, the American Psychological Association, and the American Academy of Pediatrics all support as evidence-based and for many patients medically necessary. And let's be absolutely clear about what Republicans are claiming to prevent versus what they're actually causing, because the overwhelming majority of kids who receive gender-affirming care report high levels of satisfaction and low levels of regret, and research shows that detransitioning is quite rare, with some studies finding levels as low as 1%, and one recent study published in Pediatrics following over 300 transgender youth after social transition found that over 92% remained consistent in their gender identity 5 years later. So this panic about children making rash decisions that they'll regret is not supported by the evidence, but what we do know is that transgender children and adolescents face rates of anxiety and depression that are as much as 10 times greater than those of their cisgender peers, resulting in alarmingly high rates of suicidal ideation and behaviors. And this higher suicide risk is not unavoidably associated with transgender status, but instead is the result of stigma, discrimination, and mistreatment. So when this physician says Republicans are pulling families into a dangerous political crusade that targets vulnerable transgender youth, she is being precise and she is being accurate. This is political violence masquerading as child welfare, and it follows a very specific historical pattern, because we have seen this before. Every single time a marginalized group has fought for recognition and rights, the opposition has claimed to be protecting children. They said integrating schools would harm children. They said allowing gay people to be teachers would harm children. They said marriage equality would harm children. And now they're saying acknowledging and supporting transgender children harms children, when the actual evidence shows that what harms children is rejection and discrimination, and being denied medical care that they need. In recent years, the United States has witnessed an increase in anti-transgender rhetoric and messaging, with right-wing politicians investing nearly $215 million in anti-trans network television advertisements in the 2024 election cycle alone, and that figure doesn't even include spending on print, online, cable, and other broadcast media. This is a multi-hundred-million-dollar campaign to demonize some of the most vulnerable people in our society, and it is working because we now have members of Congress openly calling for criminalizing parents and doctors, and the House just passed that bill. Representative Sarah McBride criticized congressional Republicans as being obsessed with trans people, saying, "I actually think they think more about trans people than trans people think about trans people. And that would be funny if it weren't so tragic, because this obsession is literally killing people. And we need to talk about Marjorie Taylor Greene specifically, because Greene is resigning from her House seat in January, but made a deal to ensure her signature anti-trans bill would get a vote on the House floor in exchange for her support on the National Defense Authorization Act. The bill reached the House floor for the first time after she repeatedly introduced it since 2021, so she traded her vote on funding the military for the opportunity to criminalize healthcare for transgender youth, and that tells you everything about the priorities and the moral bankruptcy of the modern Republican Party. They don't care about healthcare. They don't care about national security. They don't care about the deficit. They care about culture war red meat that they can throw to their base, and transgender children are the sacrifice they're willing to make for political gain. This physician is warning us about breaking the critical trust between patients, their parents, and their physicians, and this is fundamental to how medicine works in a free society. Medical ethics is built on the principle that doctors have a duty to act in their patients' best interests, based on medical evidence and professional judgment, not on the basis of what politicians think is appropriate. Medical decisions should be made by patients, their relatives, and healthcare providers, not politicians, and that should be completely uncontroversial. But here we are. Republicans spent decades screaming about government getting between you and your doctor when they were opposing the Affordable Care Act, but now they want the government to literally imprison doctors who provide care that the government doesn't like, and the hypocrisy would be breathtaking if it weren't so predictable. Mike Zamore of the ACLU said this extreme bill puts the threat of prosecution between hundreds of thousands of families and their doctors, and would put doctors behind bars for exercising their best medical judgment, framing the bill as part of a broader pattern of baseless politics entering medical decision-making, drawing parallels to abortion bans. And that connection is so important, because we are watching the same playbook being deployed. First they tell you that decisions about your body and your healthcare should be between you and your doctor, and then they pass laws that criminalize doctors who provide care they disagree with, and then people die because they can't access necessary medical treatment, and then they shrug and say, well, we were just protecting life. We watched this happen with abortion care, where doctors are now terrified to provide treatment even in medical emergencies because they're afraid of going to prison, and women are dying in parking lots, and now they're doing the exact same thing with transgender healthcare. We also cannot ignore the fact that in August 2025, 16 state attorneys general sued the Trump administration, arguing that their enforcement activities constituted a de facto national ban on gender-affirming care, citing intimidation of hospitals and medical professionals by launching investigations, issuing subpoenas, demanding data on transgender patients, and threatening prosecutions, and this is how authoritarianism works. You don't need to pass a law if you can terrorize people into compliance through selective prosecution and regulatory harassment, and the promise of destroyed careers and bankrupted institutions. The Trump administration has made attacking transgender people a central organizing principle of governance, and it extends far beyond healthcare. Since President Trump was inaugurated for his second term, he has made restricting access to healthcare for trans people and diminishing their existence a priority, ordering trans people to be removed from the military, excising any mention of them from federal websites, removing them from hate crime surveys, and working to restrict their access to youth sports. And this is what elimination looks like. This is a systematic attempt to make it impossible for transgender people to exist in public life. And when you can't serve in the military, and you can't access healthcare, and you can't use public bathrooms, and you can't participate in sports, and the government pretends you don't exist in their data collection, what you have is a society that is telling a group of people that they do not belong here. Now I know some people are going to say I'm being hyperbolic, or that I'm being divisive, or that I should try to find common ground, but let me be absolutely clear. There is no common ground with people who want to criminalize parents for loving their children. There is no common ground with people who want to imprison doctors for following medical evidence. There is no common ground with people who are willing to sacrifice vulnerable children on the altar of their political ambitions and their theological prejudices. The ACLU said passing this bill would be a grave escalation, allowing the state to control bodies and lives further, warning that abortion bans have already shown us the deadly consequences of putting baseless politics into our doctors' offices, and they are right. We are at an inflection point, and the question is whether we are going to allow this to continue, or whether we are going to build the political power necessary to stop it. This bill passing the House should be a wake-up call to every single person who cares about medical autonomy, about scientific evidence, about the separation of church and state, about protecting vulnerable people from state persecution. This is not a single-issue problem. This is a stress test of whether American democracy and American pluralism can survive in an era of rising authoritarianism and Christian nationalism, and right now we are failing that test. What we need is sustained mass mobilization. We need to be flooding Senate offices with calls. We need to be supporting the organizations that are fighting these laws in court. We need to be electing pro-LGBTQ candidates up and down the ballot in every single state and locality. We need to be having conversations with people in our lives who maybe don't understand why this matters, or who have been taken in by the propaganda. We need to be supporting transgender youth directly through organizations like the Trevor Project that provide crisis services, and we need to be creating safe spaces and affirming communities, because when the government abandons you, when the government actively persecutes you, mutual aid and community solidarity become matters of survival. And we need to remember that this fight is part of a much longer struggle for bodily autonomy and medical freedom and the right to exist as yourself without state interference. The same forces that want to ban gender-affirming care also want to ban abortion. They want to ban comprehensive sex education. They want to ban books. They want to restrict contraception. They want to police who you can love and how you can identify and what bathroom you can use and how you can dress and what pronouns you can use, and they will not stop until we stop them. This is not about protecting children. This has never been about protecting children. This is about power and control and enforcing a rigid hierarchical vision of society where everyone knows their place and stays in it. But here's what gives me hope even in this moment of despair. The fact that doctors are speaking out like this physician is doing, the fact that families are fighting back, the fact that medical organizations are standing firm on the evidence even under enormous political pressure, the fact that some Republicans actually voted against this bill. Republican reps Gabe Evans of Colorado, Brian Fitzpatrick of Pennsylvania, Mike Kennedy of Utah, and Mike Lawler of New York voted against the measure, which shows that even within the Republican caucus, there are people who understand that this crosses a line. We need to be organizing, we need to be resisting, we need to be building power, and we need to be absolutely uncompromising in our defense of transgender people's right to exist and to access healthcare, and to live with dignity and safety. This vote that just happened in the House is a moral atrocity, and it needs to be treated as such, not as one more talking point in an endless news cycle, but as a fundamental assault on medical ethics and human rights, and the basic principles of a free society. When they come for the doctors, when they come for the parents, when they come for the most vulnerable children among us, that's when you find out what kind of country you really live in, and what kind of person you really are. I know what side I'm on, and I know what side history will judge as righteous, and I am telling you right now that we are watching a persecution unfold in real time, and future generations will ask what we did about it. So let's make damn sure we have a good answer.